Hi guys. So how are you all today? It's very cold now. So today I'm going to talk about oral halitosis. I have my notes with me so that I don't forget important parts. So what is oral halitosis? Oral halitosis is a bad breath. Okay, most commonly known as bad breath. So when you have a person who has bad breath, we call it oral halitosis. So almost around 50 to 90% of people at some point of time in their life they've had smell from their mouth. Why does it happen? The oral halitosis usually happens because the food particles in our mouth, they get broken down by the bacterias and they release sulfur products. Okay, so sulfur products are released, and sulfur, as it is little smelly, so our mouth also smells. These are the usual cause of oral halitosis. Oral halitosis can be normal, like morning breath. It is normal and physiological. There is nothing to worry about. Smell can also be caused by some kind of foods. Okay, so like you have garlic or onion, you have smell from your mouth. Because obviously the onion, it has very large quantity of sulfur, so it breaks down and smells, and similar with the garlic also. Then there can be other issues. Okay, so oral halitosis may not be because of any systemic diseases, but it can indicate poor oral hygiene. So, if you are not brushing properly, your teeth are not clean, you can have bad breath. You can uh, mostly have it because of bad oral hygiene. You are not brushing properly, inadequate brushing, inadequate flossing. This can cause oral halitosis. Okay, then there are other reasons, like when you have because of parodontal issues. So when your oral hygiene is bad and it causes halitosis because of gum disease in your gums, it is called periodontal issues or gum issues. Okay, so you can have it because your gums are not okay. You have something called pyria or calculus, so that can lead to bad smell from the mouth. It can also be because of uh, dry mouth. Okay, so you can have dry mouth. What is dry mouth? Dry mouth can be because of reduced saliva, or it could be because of some systemic diseases. Okay, reduced flow of saliva or xerostomia, as we call it in medically, can be caused because of systemic disease like Sjogren syndrome. It can be caused because of medications. It can be caused because of excessive alcohol consumption. I'm so sorry. It can also be caused because of dehydration. Okay, so if you are not drinking enough water, you can have a dry mouth. If you have Sjogren syndrome, you can have dry mouth. You have a lot of alcohol after party, you have dry mouth. Okay, so if you have dry mouth, you can have smells. Then you can have smell because you have dry mouth and it leads to coating on your tongue. So coating on your tongue could be because of bad oral hygiene along with dry mouth. Okay, so sometimes for some patients, the small fibers on the tongue, they grow a lot. So you have because they don't get shed, so you have them trapping food into the biofilm, and when that biofilm breaks, you have the bacteria there, and that causes the smell like we discussed. So the biofilm which traps the food debris and the bacteria that reduce the food debris, it can cause smell in your mouth. Okay, uh, Then we can have oral caries. Okay, so if you have cavity in your mouth and food is getting stuck on there, again the same thing, you will have bad smell from the mouth. Or could be oral infections. So if you have cavities that leads to infections, abscess, or other oral infections like necrotizing gingivitis, even like I said, we spoke about coating on your tongue. So if you have a lot of coating and your immunity is going down, then you can also have candidiasis. Candidiasis is a fungal infection on the tongue or in the mouth. So it usually happens where in the combination where your immunity is going down and you are not able to maintain the hygiene, and you also have reduced flow of saliva because of any reason. You could be sick, you could be having issues. So that leads to fungal growth on the tongue or on in the mouth. So that also leads to bad smell. Then you could also have bad smell because of sinusitis. Okay, so there is a nasal drip or you have infection in your sinus, so you can have bad breath in your mouth because of nasal issues. You can have bad breath because of your throat, so you have throat infection or you have tonsillitis or there is a stone or debris stuck in your tonsils, so you can have bad smell in your mouth because of that also. Then there is called GERD or acid reflux. When you have acid coming up or fumes of acid coming to your mouth multiple times in a day. Okay, it could be because of acidity or it could be some other issue. So that also would lead to having smell in your mouth. Then there can be systemic diseases. Okay, so diseases like diabetic ketoacidosis, liver failure, which has mousy smell. Diabetic ketoacidosis has fruity smell. Liver failure has mousy smell. Kidney failure has ammonical, and some cancers also leads to smells in later stages. Okay, but they are less than 5% chances of systemic diseases causing oral halitosis. Okay, it's very less. So, how to treat it? Okay, for the systemic diseases, all the infections like you have fruity smell, ammonical smell, you have to rush to your physician or to the doctor who has been treating you. Okay, you might have to go to emergency and get yourself admitted in the hospital in some cases. So if you have these kind of smells, the systemic smells, you need a physician. A dentist will not be able to help you out. He may be able to diagnose it or let you know that there is something wrong, but the treatment would be done by the physician or the respective doctors. Okay, the experts. Same goes for your GERD. You have to go to physician to get your stomach checked up. Okay, it is related to your stomach, so the treatment needs to be done for your stomach. It is, even though the smell is in the mouth, the problem does not lie in the mouth, so we have to look into the root cause of the GERD. Okay, then sinusitis, again systemic diseases, you have to go to your ENT. Same goes for your tonsil. You have to go to your ENT and get it checked up. They will treat it accordingly. Then for poor oral hygiene, okay, you have to brush twice daily. It is important that you brush twice daily. If possible, please floss twice daily. Flossing is also very important so that the oral hygiene is maintained and food is not getting stuck in your gums. Gum massaging with either gum paint, or you can do small household gum massaging with lubricating oils. Okay, edible oils like mustard seed oil or maybe coconut oil. You can use that. It has its own benefits, so you can do massage with that. or there are gum paints available in the market. You can use them to massage your gums. Massaging your gums makes them stronger so that food does not get stuck easily. Dental caries, you have to get it treated. You have to go for root canaling treatment, or you have to go for restoration, that is filling of the tooth. So you have to get it treated. Only then the smell will stop. Okay, for dental caries. Then sometimes there are denture related or maybe some kind of appliance related smell. So for the patients who have orthodontic wires, they can have food getting stuck, so they can have halitosis. There are patients who wear dentures and food is getting stuck there, they can have halitosis. There are patients who after the completion of treatment are wearing retainers, or maybe for some kind of uh, correction, are wearing some dental appliances, so they can have halitosis also, again because food is getting stuck. So by maintaining the oral hygiene methods, that is cleaning up and using interdental brushes and flosses, the oral hygiene can be maintained. You can also use for short period of time the mouthwashes. Okay, chlorhexidine mouthwash can be used to reduce the bacterial amount. Okay, long term use of mouthwash I do not suggest. Okay, you don't have to do it every single day, because some of the mouthwashes are alcohol based and they may in long term lead to some kind of drying of the mouth. For dehydration, you need to take water. For the patient who have dehydration due to medication, they also need to take, increase the intake of water and ions. They can discuss it with their physicians. Patients who have diseases like Sjogren syndrome, which reduces the saliva flow, okay, or maybe palsy of your nerve. So for those patients, repeated use of water is advised. You can also take sugar-free lemon candies. It increases the flow of saliva. Then you can also have uh, there are artificial salivas available. They're not exactly saliva. They are fluids which help in lubrication of the mouth. Okay. So for those who don't have enough flow of saliva, can also use that to reduce the oral issues. Okay. But taking a lemon can help you. Okay. Then comes the patient who have infections. Again, treatment of the infection will lead to reduction of the smell and maybe elimination of the smell. For the patients who have periodontal or gingival issues, they need to get scaling, cleaning done, and doctor need to check for the periodontal issues. Okay, so the periodontal disease or gum disease needs to be checked up, why it is happening, what is the root cause. If there is calculus, we need to clean it up. If there is some kind of systemic disease, we need to take care of that, and that would help in reduction of the smell. Coating of your tongue, again, oral health issues, we need to improve the hygiene and the bad smell will go away. So the base is go to your doctor, get it checked up. If you're feeling there is something in your teeth or in your mouth that you have smell, please get it checked up, because it could be something as normal as morning breath, or it could be some kind of systemic disease that you have missed. Okay, so get yourself checked up to your dentist, and in case of any issues, any queries, please let me know. You can comment, write your problems or discuss. Please like, share, subscribe if you like the content, and let me know what all content you want to know about, or you want me to make a video about. You are watching Say Out Loud with Komal, and this is goodbye from Komal. Take care. Bye bye. Good night.